people of the internet. My name is Frida Weisel. I am a tour guide in the Jewish Hasidic communities in Brooklyn, New York. And I decided to try something different, a video post, a vlog, and see how it goes. It's a little scary, but I am going to be talking about the measles outbreak in the Hasidic community, on which I have quite a bit to say, and I'm going to try to frame my video in a question and answer format. It's a little bit gonna hopefully keep me organized. So the first and most topical question, is it safe to tour the Hasidic community during the measles outbreak? And this goes to anyone who's interested in coming on my tour and is concerned. So for me, I will tell you what my doctor told me, which is if you're immune, you're okay. I was vaccinated, but the doctor ran blood work, they call it titers, where they check if you have immunity, and I'm immune to measles, mumps, and rubella, and I feel totally comfortable walking through the Hasidic community. And, you know, I hope you will too. If you have children who are too young to be vaccinated, or you have family members who can be vaccinated, I would suggest you talk to your doctor. I think that would be the best way to go about it. I know there have been some people who plan to come on the tour, but they have babies and were worried, and they made alternative plans. If that is the case for you, I totally get it. I will work with you. Just let me know what makes sense for you and your family, etc. The outbreak. What's going on? It looks like there is a global recurrence of measles. It's coming into the United States from several countries where there has been really high levels of measles instances. Measles is extremely contagious. You don't need physical contact in order to get measles. It can transfer in the air, and people who are unvaccinated stand a 90% chance of getting the virus. And it's been raging in the Philippines, in Ukraine. Ukraine had, in the last 12-month period alone, they had 72,408 cases, which is a very high rate of instances. In 2016, the WHO reported that only 42% of the Ukrainian children were vaccinated, so that allows for the virus to spread. It looks like a Hasidic child, or maybe several instances, brought it into the States via Israel, where it's been brought in from Ukraine, or it might have been direct transmission from Ukraine through pilgrimage. But this is something that is not exclusive to the Hasidic community. I read about the Hasidic anti-vaxxers. Are Hasidim anti-vaxxers? No. As a communal value, Hasidim embrace vaccines. There are always individual opinions, there are always exceptions, there are always dissenters, but as a whole, the Hasidic community is pro-vaccine. We can say the Hasidic community is pro-vaccine in the same way as we might say that Americans are pro-individual liberties. Of course, there are different opinions within that culture, but as a defining characteristic of a general community, the generalization is correct. And Hasidim definitely are pro-vaccines. But Hasidim are anti-science and anti-modernity. How could they be pro-vaccines? Come on my tour, first of all. There are a lot of complex contradictions. You cannot simplify the Hasidic community pro or anti-science. In fact, the Hasidic community is very pro certain very advanced sciences and modern medicines, to an incredibly fascinating extent. You can read, I'll include links to the story in the Washington Post about the IVF centers where Hasidic people will receive in vitro fertilization if they suffer from infertility. You can read about the tremendous fight that was going on between Hasidic charity organizations and hospitals like New York, NYU, because the Hasidic community felt like the hospitals were pushing towards removing people from life support. So the Hasidic community would be pro extending end-of-life care that extends life as long as possible. You can look up the Dor Yeshurim website, which is genetic testing before couples get married, which is essentially a little bit of playing evolution when you determine who can get married to whom based on genetics. So this community is actually very interestingly very pro a lot of medical interventions, including vaccines. But what about other ways in which they are anti-science? So we've seen these comparisons to two main issues, metzitza and education, and I'm going to summarize these two very quickly. The metzitza issue is a part of circumcision when there's an old custom in Orthodox Judaism of the person who performs circumcision cleaning the wound with oral contact, mouth to wound contact, and it has resulted in the transmission of herpes to the newborn infant. This has been a big topic of contention when the Bloomberg administration tried to stop that particular part of the circumcision ritual. Ultimately, the Hasidic community got their way and they continue to perform that ritual. There is also the education issue, which I have so much to say on, and always get into trouble whenever I open my mouth on that issue. But briefly and objectively, removing myself all the way, I will say the Hasidic community does not provide to its boys anywhere near the standards of secular education as required by law, and there's been a big effort from the outside to force them to amend their education system for boys, and this, the Hasidic community has been up in arms about, crying foul and doing whatever it can behind the scenes to manipulate politics so they can have their civil liberties, religious freedom exemptions. Both of these issues, the herpes as well of metzitza as well as the education issue, have been widely covered in the secular news. But just because you know of two issues doesn't mean that the third is the same. People on the outside hear about three things and they put it all in the same category. But when it comes to education, when it comes to circumcision laws, these are religious hot topics. You're stepping on very raw nerves, and the Hasidic community is up in arms. This is totally a different story when it comes to vaccines. It doesn't have any of that religious soreness. It doesn't have any of that loaded, powerful background for the community. It's just simply not ever been a religiously loaded topic. You know, when the Hasidic community feels like they are being forced by the government to give up their religious liberties, they react. I mean, there is a ruckus. They will organize in every way possible, fill stadiums with protesters. All the boys will be bussed in, and they will use every possible means to get their way. With the measles outbreak, you haven't seen the editorials in the Yiddish newspapers, week after week. With the measles outbreak, you just didn't see that. In fact, I buy the Yiddish newspaper and I read about the education. I read about the terrible anti-Semitic outside interventions on education or other issues, but nothing, not a word about vaccines. In fact, the only thing that you really read about vaccines is what a terrible embarrassment the minority of anti-vaxxers have created for the community. But vaccines have pig skin and are not kosher. I don't know. I'm not even going to answer that question. There are a lot of contradictions in Hasidic life. You can't just use your own logic in a vacuum as an outsider to decide what's okay and what's not. You'll become more religious than everyone else. I know, the New York Times was just writing about it. Margaret Rankel wrote in the New York Times that of the 764 confirmed cases so far this year, the vast majority are clustered in New York City, primarily in ultra-Orthodox communities where some view vaccines as a violation of kosher restrictions and a danger to children's health. I mean, what can I say about this? They do not view. No one views vaccines. The problem with saying this is you're going to decide on, based on logic, what the Hasidic community believes without evidence. You're going to end up on the wrong side. Just because there's pig in vaccines, if there is or isn't, I don't care, doesn't mean you can conclude that it's not kosher. You're not the rabbi. I mean, with all due respect, whoever this Margaret Frankel is. Anything like saying it's not kosher or saying it's a violation to meddle with the child's health, these things are post hoc. Only after someone has established their view are they using every possible tool to rationalize and get away with whatever it is they believe. But then why aren't they cooperating with the city? They are. So as of April 28, 21,284 doses of the MMR vaccine were administered to people under age 19 in the Williamsburg and Borough Park neighborhoods. This, according to the NewYorkCity.gov health website. So that's a lot of vaccines. And yes, 7 yeshivas have been closed, but they have also been reopened. And the schools have been demanding of parents to show proof of immunity. So from their end, they have been doing whatever they can. Keep in mind that if 21,284 people are vaccinated, a good number of these people can't go to school because the city closed the school because of those who haven't shown evidence of immunity. That is not something most people are going to be happy about. Then why is the outbreak so bad? Okay, I think we need to look at bad in perspective. There have been about, I don't have the exact number, about 360 cases out of a population of 100,000. It's 0.36% of the population. It's not good, and this is highly contagious. It's not good on many levels. But that doesn't mean that vaccines aren't significantly reducing the badness. If you think of only 360 cases, it is a huge vaccine success rate. But there are many more outbreaks among the Hasidim. Doesn't that prove that they have more anti-vaxxers? Not necessarily. More measles cases does not mean more anti-vaxxers. Hasidim are a particularly vulnerable population for two main reasons. First of all, they have the youngest populations. Kiryas Joel, where I come from, has a median age of 13. I'm using the number from Kiryas Joel because the census for Williamsburg is mixed with other neighborhood populations, so it's not useful. So the median age in Kiryas Joel is probably lower than in Williamsburg because Williamsburg is a little more liberal, a little more open than Kiryas Joel. But in Kiryas Joel, a population of 25 to 30,000, the median age is 13. 13, this means half of the population is 13 or younger. Half. The median age in New York State as a whole is 38.2. So compare these two. If you have half the population under 13, you're going to have a lot more babies. If you have a lot more babies, you have a lot more unvaccinatable individuals, which means more carriers, a higher susceptibility rate. So in order to have herd immunity, you need something like 95% of the population to be immune. What if you have so many children that they make up 10% of the population? You're now having a much harder time curtailing an outbreak. The second reason why the Hasidic community is more susceptible is because the extreme contact that people have with each other. They're in extreme physical, they are in very tight physical contact. I'll give you an example of what a Hasidic kids. The other reason is because of the concentration of people in the Hasidic community. Think about it this way. If a Hasidic child comes back from Israel with the measles, let's see how much contact he has. So he gets up in the morning. First of all, he's in a family of 6, 8. He's exposing his siblings, especially if there's a baby. He gets up in the morning. It goes in a bus. Hasidic buses are those large buses. So he's on a bus with 20 kids. All of them have been exposed. He goes to school. He's in a classroom with 30 kids. All of them have been exposed. He then is in a lunchroom with 250. He's in the courtyard playing. He's back on the bus again. He goes home. He's playing with the neighbors. And then let's say he's going to a wedding where he's again exposing 250. Contrast that with my son, for instance, who's in public school. He gets let out at 3 o'clock and he's pretty much home with just me. He might go to the library where the majority of the people are also adults. So one Hasidic child puts at risk so many additional others. So one Hasidic child creates so much more contact than a typical American kid, which again increases the likelihood of it spreading and multiplying. But Curious Joel had fewer instances of the outbreak than Williamsburg. Now this is really interesting. Curious Joel is also very insular, also very low, very many babies. Almost every household has a baby. Also a lot of contact, and yet we've seen much fewer instances of the virus, although we have seen higher instances than in the rest of, although we have seen more cases than in the greater population. Why? It's interesting, and I think it is because Curious Joel is more closed off and more authoritarian, and the school administrations have a lot more control over parents than Williamsburg, and there's less room for dissent. So the fact that there are these dissenters in Williamsburg is not a feature of additional religiosity. It's actually a feature of a more secular, individualistic streak in Williamsburg. So tell me about the anti-vaxxers already. Spill on these juicy details. Here's what I've come to understand from fishing around. This is a group of people who see themselves as smarter than everyone else. They are very confident. They are very strong with themselves. They are very defiant, and they are into a whole number of these alternative, fringe, if you will, ideas, and they see themselves as more enlightened, as more informed. They do all of that research and reading, and they'll do home births, and they'll do you'll see all of these trends. I remember I knew someone who was into gluten-free even before anyone knew of gluten-free. Also in the Hasidic community, they're very busy with themselves, and they have been used to just filing religious exemptions for a long time and have not been challenged by it. And now they have felt very besieged. They have felt like they are under attack, and they have been insisting that this is anti-Semitic, that this is the 1930s, and feeling very much like they're being singled out because they're Jews and because there's some kind of conspiracy. I feel like the anti-vaxxers are every society's group of people who are a little bit conspiracy theorists, a little bit unable to keep in perspective risk, unable to keep in perspective their effect on someone else. So they're very micro thinkers. They're very individualistic. I always have a really hard time with people who cannot see past the end of their nose. But there are these people, and they'll say, I want to do what I want to do, and no one else can tell me. And if you argue with them, if you reason with them, you're talking to avant, to no one, to the wall. You're just not going to penetrate. They can only see themselves in a vacuum. Their formula for analyzing the risk of a vaccine, for instance, is what are the risks of the MMR to my healthy child versus the risk of measles to my healthy child. And what's so infuriating to me is that no, that's not the formula. The formula should be what are the risks of MMR to my healthy child versus measles to my child and all the children who will get it. There is a subsect of every population apparently, and this is especially pernicious in certain libertarian circles where people cannot grasp the invisible cause and effect between their own actions and other people's lives. And that's just, it seems, who these individuals are. They also seem to be contrarians, a little bit like the profile of the Natira Karta in the Hasidic community, which I wrote about in a different post. I have a very hard time with such people. I find them to be extremely stubborn and extremely unreasonable and very frustrating, but they're not, what defines them is more their personality and propensity to think in conspiratorial ways than it is their Hasidic background. But this Hasidic woman told reporters that she doesn't vaccinate because it's her religious freedom. Religious freedom is an American concept. It's not a Hasidic concept. No one says, well, I'm going to change. You know, in the Hasidic community, you have to wear calf-length skirts. And people don't say, well, I'm wearing a fully langa punjalo, just like a long robe, which a lot of people will insist is not modest, because it's my religious freedom. There is no concept of religious freedom within the Hasidic community. The freedom part is a little bit the antithesis of the Hasidic religion. If you don't want to vaccinate, you learn the language of American society. You learn to say, it's my religious freedom. You also learn to throw out any argument that's going to work for you. That doesn't mean you should take it at face value. That doesn't mean that what's really driving someone is objection on religious ground. You know, if I'm going to say I don't want to go to work because of my religious freedom every Monday and Wednesday, you're not going to believe me just because I said it. I need to back it up. You should stop believing what Hasidim say at face value. You have to look at more complex sociological elements that are happening underneath. But what about religious exemptions for vaccines? What of? Were they created for the Hasidic community? Not that I know. I don't know where they come from. They aren't a facet of Hasidic life. We shouldn't pin it on Hasidim just because some Hasidic women are finding it useful. I should also tell you that if you look at the number of religious exemptions in the Hasidic community, it's not necessarily indicative of what people believe, because people will use religious exemptions as a cover for medical secrets. So even if the religious exemption is high, which I don't think it is, it's still not going to necessarily reflect how many people claim exemptions on medical grounds. But these Hasidic women wouldn't believe such nonsense if they got a full secular education. How do we even know? How do we know? I mean, count the number of fringe folks in Silicon Valley. Jack Dorsey, the founder of Twitter, according to the latest article in the New York Times, maybe I shouldn't believe them so much. He does these infrared saunas and weekend fasting and one meal a day. And people are rushing to buy the saunas just because he has endorsed it. What is he, a doctor? People believe nonsense. We as humans have a limited capacity to understand most more complicated things, and we have to go based on trust. I don't understand why I need to, I got a tetanus shot because a dog bit me. I don't understand why I need it. You think I understand? Does that make me more clever? I don't. I have no idea why I need it. I don't understand how it works, what it's going to do, but I trust my doctor because I know that I cannot find out these things, all these little things on my own, and I have had sufficient experience that is positive that makes me believe I can trust my doctor. People will trust Jack Dorsey on medical advice because he has accomplished Twitter and Square something, I forgot what it is. And people will trust alternative medicine theorists because they seem either more emotionally invested or more generally focused on being individualistic, or just more there, or maybe feels more intellectual. We're fooling ourselves. We're all naive, and we're all trying to make sense of information. Some of us more effectively, I think, accounting for risk factors and consequences on a larger scale than others. So what do we do about these anti-vaxxers? What we do is we take their like Peach magazine. It's not Peach, this is a different magazine. This is Pro magazine. We take their Peach magazine, we cut out the pages, we slip in romance novel pages, and we, tuck it in their pocketbook. And then they will be like regular housewives reading romance novels, addicted to it. No offense to romance novel readers on the train whose Kindles I lean over and read. I think the law is gonna have to dictate, I think shaming is not the solution. I think gloating is not the solution. I think making ourselves all angry about them is not gonna help. I think obsessing over a minority of nuts is not doing anyone any good, just gives them oxygen, and it's not healthy, I think, for our society. I think we just have to make sure that the laws are enforced and are created so that these specific people don't hurt other people. The city needs to be on top of Hasidic schools, and it needs to be very seriously enforced so that the people who have specific beliefs that are dangerous cannot hurt other people. I mean, I think there is an element of hysteria with the whole measles outbreak, but I do think the overall question, what happens when people believe nutty things that might not hurt them so much as it might hurt someone else? The answer is really using the legal system to ensure that that doesn't happen. And I am convinced that the Hasidic anti-vaxxers are not powerful enough to stop the legal system. They might be able to continue to not vaccinate by homeschooling, sending to their own school, but not by stopping the implementation of specific laws. The Amish also have large outbreak. Is this the same cause? How the hell would I know? I'm not any more informed about the Amish than you. I just caution you. I see people do this often. They extrapolate conclusions from one insular society based on the features they know of on another, and I think it's incorrect. It's better to just find out what they are. Go find out what the Amish are doing instead of concluding based on the Hasidim. Has the media accurately portrayed the outbreak? No. I'll tell you what we have seen mostly in the coverage has been health reporters filing the CDC's numbers as stories. So they'd use two things. They'd use the number of measles cases for the year, and they'd quote the CDC website, which says the majority of people who got measles were unvaccinated. And when people read that, they're like, oh, these anti-vaxxers, it's all them. But the problem is that you have to draw a distinction between unvaccinated and anti-vaxxers. Unvaccinated is not synonymous with anti-vaxxers. If you have an oncology ward with pediatric patients and they're all unvaccinated, they're not anti-vaxxers. If you have a maternity ward with babies who are not vaccinated, they're not anti-vaxxers. a lot of the people who are unvaccinated who were affected by the outbreak were actually very young. Babies who were too young to have been vaccinated, or children who for whatever reason had to have their vaccines delayed. So you can't just focus on this word unvaccinated and then obsess over anti-vaxxers. Why do you think the media has been covering this so poorly? Because I think anti-vaxxer stories are really, really profitable clickbait. In fact, I think I should title this video, Everything You Should Know About Anti-Vaxxers and Their Underground Bunkers, and then everyone will want to watch it. I think they're one of those demographics that are low-hanging fruit. They're so easy to hate and feel self-righteous about, and that drives the clicks. And who's to push back against these narratives? Who's to call out the media? I've seen several media narratives on news items like the Venezuela story, the Jewish cartoon of Benjamin Netanyahu. We've seen these very powerful voices on the periphery who are really pushing the New York Times, pushing back, and ultimately the New York Times does have to acquiesce, or it does have to open itself up to whatever these voices are telling is missing from these narratives. The Hasidic community does no PR. If I ask people in the community, what do you think of the coverage? They'll say, these anti-vaxxers have really embarrassed us. The fact that the coverage has portrayed everyone like anti-vaxxers and like they've taken it upon themselves and like they're all self-inflicted and they are all trying to pass it on recklessly doesn't seem to even pop up on their radar, because they don't see media narratives as controllable. They don't approach media narratives as something you twist. They rather approach it as something you watch cynically for the next anti-Semitic story. So the coverage of the outbreak made things look bad, made the Hasidim seem at fault. Why is it really a problem? I think reporting should be fair and complete and have context on principle. That's what the media should do. For no other reason that should be the goal, even if no one else calls the media out for poor reporting. But of course, there are reasons that there are actual consequences to bad reporting. First of all, there's my suffering, which is important here, that I can't read any news article about a complex community, like there'd be stories on China and Russia. I can't read it anymore and take it seriously. I'm like, they don't get it. They find someone who's in authority who's going to say what they already hear. There's always like a very narrow, very shallow story, and then there's an opportunist who's willing to repeat it and claim to be an expert. So my own ability to enjoy and read the news has been ruined. Also, you're kind of creating a self-fulfilling prophecy for the Hasidic community, where they feel besieged, where they feel aggrieved, where their sense of they all just hate us feels real, because the reporting is not accurate, it's not fair. So how are you helping? How do you expect people to listen to you if that's what you're showing them, that you have no concern for accuracy? And should we really be creating hate? I am very uncomfortable with the kind of smarmy, ooh, these Jews comments. Profiling, we have established, is so problematic. It is potentially hurts so many innocent people. If we profile people by their appearance just because of a minority, I think we should be careful with that. Just because this is a community that we feel is fair game to tear down doesn't mean we should let go of principles of avoiding profiling an entire community. But you know, the most important part is I have watched the coverage and I've been extremely confused, and the coverage was totally useless to me. And I felt like it was so busy with the anti-vaxxers that no one else knew what to do. No one else knew how to go about it. I've learned through Facebook that there were people who thought they were vaccinated, who ended up getting the measles. Someone created a video begging people to make sure that they have sufficient immunity. And I wouldn't have known this from the news. Why? It wasn't hard to find out that people who had vaccines were getting the measles. Why didn't we know that people who were vaccinated were getting the measles? That is an important component of the public health conversation, but we don't know it if the media is busy with a distraction. What does good coverage look like? Talking to people in the community, even if it's not easy. You mostly remembering that Hasidim are human beings. That would help, yeah. Not a bunch of freaky zealots walking the streets, but human beings with all their quirks. That would be a good starting point. And talking to people in the community, doing your work. Your goddamn work.